Headache and eye disease? Contexts. When headaches come from the eyes. According to a Danish study, 3% of all headaches can be traced back to eye diseases. Because in the area around the eyes there are many very sensitive nerve fibers. If these are irritated, they can easily radiate into other areas of the head. Those affected often find it difficult to decide what is causing the symptoms. We show you which triggers can be behind the headache in the eye area and what to do in each individual case. The stressed eye. Reading for hours in incorrect or insufficient lighting, or exerting yourself from prolonged computer work can cause headaches. The eye is often the cause of the complaints. Because a small muscle is responsible for close vision, the so-called ciliary muscle. If it has to tense up all the time, it hurts. And that can cause a headache in the eye area. Sometimes an untreated ametropia or the wrong glasses are behind the overload of the ciliary muscle. Emergency. Headache around the eyes from an attack of glaucoma. Severe eye pain and headache in the forehead area or sometimes toothache, nausea, weakness or visual disturbances, seeing colored rings, blurred vision, are among the symptoms of a glaucoma attack. Usually only one eye is affected. The eye looks cloudy and rock hard. In the event of a glaucoma attack, the intraocular pressure suddenly rises sharply, sometimes by more than 3 times the normal value. This is a medical emergency that requires immediate ophthalmological treatment. Cluster headache, stitch in the eye. The needle in the eye. Those affected experience an attack of the rare cluster headache. This form of headache manifests itself through frequent and unbearably strong pain attacks and should best be looked after by experienced doctors in specialized headache centers or outpatient departments. Researchers do not yet know what the cause of the disease is. It seems that genes play a role, because the condition occurs in families and mainly affects men. The severe headache around the eyes lasts for 15 to 180 minutes. They are always one-sided and often occur in combination with reddened, watery eyes, a drooping eyelid, a blocked nose, sweating in the forehead area and restlessness of movement. Occasionally, cluster headaches are mistaken for eye diseases or sinus infections. The clinical picture is little known, even among doctors, and it often takes 3 or more years before the correct diagnosis is made. Cluster headaches are so far not curable. Targeted drug treatment can effectively alleviate headache attacks in the eye area. Drug therapy is just as important in prophylaxis. Other headaches that may affect the eyes. Migraine. This second most common of all headache types often affects the eyes. Accompanying symptoms such as sensitivity to light, tearing and flow of the nose are typical. Temporary visual disturbances are also common. Those affected see double vision and the eyelids can droop. Specific migraine medications can usually relieve headaches and eye discomfort. With a special form, the so-called eye migraines, headaches do not necessarily have to be present. The migraine of the eyes shows itself as a so-called flicker scotoma, which means that those affected suffer from flickering, flashes of light and a narrowing field of vision. A doctor should definitely clarify whether it is an ocular migraine when these symptoms occur. When you need to see a doctor. Even if not all symptoms that require a doctor's visit can be listed here, there is a good rule of thumb for a safe assessment. If you suddenly have massive headache or severe eye or headache, you should consult a doctor. If you have headaches that you have known for years, change or new accompanying symptoms appear, you should consult a doctor. It is best to talk to your family doctor first, who may refer you to a specialist, neurologist or headache center.